Formica Rufa, Boric Materia Medica, crushed live ants, an arthritic medicine, gout and articular rheumatism, pains worse, motion better, pressure, right side most affected, chronic gout and stiffness in joints, acute outburst of gouty poisons, especially when assuming the neuralgic forms, tuberculosis, carcinoma and lupus, chronic nephritis, complaints from overlifting. Apoplectic diseases has a marked different influence on the formation of polypi. Head, vertigo, headache with cracking in left ear, brain feels too heavy and large, sensation as if a bubble burst in forehead, forgetful in the evening, exhilarated, coryza and stopped up feeling in nose, rheumatic iritis, nasal polypi. Ears, ringing and buzzing, cracking in left ear with headache, parts around ear feel swollen, polypi. Stomach, constant pressure at the cardiac end of the stomach and a burning pain there, nausea with headache and vomiting of yellowish bitter mucus, pain shift from stomach to vertex, gas cannot be passed. Abdomen and stool. In the morning, difficult passages of small quantities of flatus. Afterwards, diarrhea-like urging in the rectum. Pain in bowels before stool with shuddering chillness. Constriction in the anus. Drawing pain around navel before stool. Urine, bloody, albuminous with much urging. Quantities of uretus. Respiratory, hoarseness with dry sore throat, cough worse at night with aching in forehead and constrictive pain in chest, pleuritic pains. Sexual, seminal emissions, weakness, slothful to venery. Extremities, rheumatic pains, stiff and contracted joints, muscles feel strained and torn from their attachment, weakness of lower extremities, paraplegia, pain in hips, rheumatism comes on with suddenness and restlessness, sweat does not relief after midnight and from rubbing. Skin, red, itching and burning, nettle rash, nodes around joints, profuse sweat without relief. Modalities, worse, cold and cold washing, dampness before a snowstorm. Better, warmth, pressure, rubbing, combing hair. Relationship. Compare formic acid, chronic myalgia, muscular pains and soreness, gout and articular rheumatism which appear suddenly. Pains usually worse on right side, motion and better from pressure. Failing vision, increases muscular strength and resistance to fatigue, feels stronger and more fit in ordinary walking, marked diuretic effect, greater elimination of products of dissimilation, particularly urea, tremor, tuberculosis, chronic nephritis and carcinoma, lupus, etc. have been treated successfully with injections of formic acid of a dilution corresponding to the third and fourth centesimal. In prescribing it for varicose veins, polypi, catarrh, Dr. J. H. Clark orders an ounce or 2 of a solution of formic acid in the proportion of 1 part of the acid to 11 of distilled water. Of this, 1 teaspoonful is taken in a teaspoonful of water after food once or twice daily. Pain in aponeurosis and muscles of head, neck and shoulders before a snowstorm. Rustox, Dulcamara, Urtica and Juniperus contain formic acid. Wood alcohol, when taken as a constituent of a beverage so common in these prohibition days, is not eliminated easily and is slowly converted into formic acid, attacking the brain and causes death or blindness. In acute rheumatic fever and acute gonorrheic arthritis, formic acid 6x every 6 days, 1 cc, sometimes 12x in sensitive patients shows often splendid results, abolishing the pains and preventing reoccurrence. Chronic arthritis needs a special discussion. Clinical experiments of the Herring Research Laboratory of the Hahnemann Medical College of Philadelphia on a great number of cases of arthritis with formic acid showed that it preferably acts on the ligaments, capsula and bursa of the joints. Such kind of cases respond very readily to treatment. The prognosis depends to a large extent upon the etiology of the case. The most satisfactory cases are chronic arthritis in connection with gouty diathesis. Chronic arthritis following an attack of acute rheumatic fever shows also remarkable results, although often pains of a neuralgic character persisting in certain spots are very stubborn. Finally, chronic arthritis of rheumatic nature can be cured by formic acid. In the latter case, formic acid 6H showed quicker and better results than 12x or 30x, which are indicated in the previous cases. In general, the disappearance of the stiffness of the joint is the first sign of improvement. Then the pain and swelling cease gradually in 1 to 6 months' time. The prognosis of the formic acid treatment is not so favorably in chronic arthritis, in which deformance processes have already taken place on the articular surfaces. Such processes in the beginning can be checked completely. Advanced cases frequently show an improvement, but there is always the possibility that this improvement is only temporary. This is particularly to be expected in the cases of the so-called arthritis deformans, in which even the inflammations on the ligaments and capsula are of a very progressive character. Dose 6th to 30th attenuation.